Could racism be playing a role in the number of African Americans being diagnosed with Alzheimer's disease?
New research in the JAMA Journal of Neurology suggests there could be a connection. Recent data suggests that black people's brains are likely aging faster than other ethnic groups because of racial trauma. That's one factor. Experts say chronic exposure to social and economic disadvantages is contributing to another growing number of middle-aged African Americans being diagnosed with cerebrovascular diseases, which includes Alzheimer's disease.
So can anything be done to change the outcome or at least slow the decline? We want to bring in Dr. Kevin Jenkins, who is the CEO of Concord Healthcare Solutions and a lecturer at University of Pennsylvania's Department of Medical Ethics and Health Policy.
It's quite a title.
Joining us.
Thank you.
Good to see you.
Thank you so much.
Why? Why is this?
Well, we have to think about it almost like that moment where we all know stress kills.
Right.
That's what we all say. Stress kills. However, when you think about racism, racism is a stressor. Racism is a stressor that sometimes we don't know how it's going to show up, even in our normal behaviors, but we often know that it does show up in our bodies. So when you get more stressed out, your heart rate goes up, your blood pressure goes up, all of these little things start happening within the body. And then as we start looking at it from that blood pressure moving, when you have these chronic diseases, your body can't attenuate, it can't get back to normal as easily. Well, it's that moment of the stress when your brain starts slowing down a touch and all of these things. Imagine the neurons literally like a little Uber going to certain parts of the body to say, hey, I need you to work harder. I need you to move faster. Well, when that happens, when you're stressed out,
Your brain would age.
your brain ages. Your brain's slowing down. The neurons aren't working.
And so what evidence was found that was done in this study, right? How many people were looked at to determine and find out, hey, they're aging faster?
Well, I want to just say, even with this study, it's taken us a long time to just connect racism to the stress. That's what I think I want us to say, even before we think about the number of people, because at the end of the day, the hardest thing that we're all struggling with is trying to just prove that racism is a stressor, right? Like, that's where we all get stuck. We all get stuck because most people assume that racism is simply an inconvenience. It's something that just makes me feel bad. It's not something that actually makes me sick.
It's like an ultimate stressor.
The
My
ultimate.
God.
The ultimate.
So how would they do MRI tests on brains then? Is that
Well, MRI tests, there's one piece, but one thing that's actually starting to happen is we're starting to try to connect the blood-based biomarkers, right? So there are little things now that people are looking at, particularly trying to understand telomere length, right? These little things that tell us the longer or shorter your telomere length may be, that's telling us as well your stress loads are higher. But we have to find better ways, and some of the stuff that we've been working on is using wrist-worn wearables, because there is a connection. Simple iWatches, right? Simple Fitbits and things like that, where we're trying to understand what's the connection between heart rate variability and stress. Because if we can understand that, maybe, just maybe, we can jump in that pathway before it gets terrible for some.
What do you say to someone who's watching may think, well, there's lots of things that can cause stress. How do you know it's specifically racism? It could be, you know, money issues. It could be your family stressing you out or your job.
Yeah. Well, the bottom line as researchers, what we have to do is we put stress under the microscope. And we have to put racism under the microscope as that stressor. So what we actually do is look at stuff like the incidence for our index for race-related stress. We look at things like up at Harvard, David Williams has worked on scales that show us what racism is. We finally hit a point where we can put those scales with the blood-based stuff now. Before, we were just having a hypothetical conversation. Now we can connect both the scales that we know show racism along with the actual blood-based biomarkers.
Well, if racism was one of the major factors, racism is not going away. So what do you do about it? Eat better, exercise, eat fruits and nuts and stuff?
Absolutely not. And that's the thing. Like, we've finally gotten the point where we can talk about it. And what we have to do, number one, is actually talk about what racism means. What is it? Right? What does it mean within a healthcare encounter? 1 in 4 people who are African American experience racism just seeking medical care. right?
Oh, we've done plenty of studies about that.
So
too.
we understand that even when I'm sick, I'm going to likely experience the very thing that's making me sick, right? So we have to also think about that. But the other thing is remembering that with the higher rates of disparity in these areas, we also have higher rates of grief, right? So that means you have black folks going to more funerals. And
More
we're not
stress.
talking, and more stress.
stress.
We're losing conversations, and with dementia, my grandmother had died of dementia. Her sisters all had dementia, and now I have an aunt that's also reeling with dementia as well. These are stories that we lose, and they're locked away and disappearing right in front of us.
So is there anything we can do now that we know this? Is there something, manage stress? I don't know. How do you?
Well, one of the big things about the management of this stress when it comes to racism is we have to talk more. We have to have more conversations. We have to understand that there is no toughness in simply saying, I'll deal with it.
Right.
Right? And that's what's been killing us, is this idea that we just sit back and we show no unmovement, on discomfort when these things happen. We have to have conversations, and that's really what we do.
That's a long conversation.
A long one,
Long,
but a
long.
needed one.
Continuous one.
Yeah.
Thank you for the work you do.
Yes, thank you so
Thank
much.
you.
Thank you.